Wagner.
Coming up.
I am very worried about Obama health care.
And
the reason why I'm worried is because under his health care plan proposal, between the supplier and the patient. In other words, you have to take what the government gives to you. You won't have an opportunity to get a second or third opinion. That's very important to a lot of people who want to shop for doctors. You won't be given that luxury.
Wow.
Thank you, Gwen. And welcome to On Second Thought, the show where William Wagner gives you second thoughts about the corruption in our local, state, federal, and judicial family court systems. I'm Joyce Pierce, co-host for the evening, and now I give you the man in the white hat, Mr. William Wagner.
Thank you, people. Taking off the white hat for you people. I take it off for you because if anybody's going to save this country, it's going to be you. That's why I take my hat off to you out there watching. Tonight we have a little discussion here with Gwen and Joyce and me about Obama's death care. It's not really health care. This is a plan to destroy American small businesses and big businesses and basically reduce America to a hobbling, wobbling, fifth-rate nation while they destroy our young soldiers overseas in wars of aggression over the fake story about 9/11 that Al-Qaeda came and bombed us and captured planes. And if you watched my 9/11 coverage last week, that's still running on the other nights, 7:30 to 9 p.m., you will know that there was 3 skyscrapers came down. Yes, 3. 7 World Trade Center came down in a perfect demolition job 6 hours after the Twin Towers, and no plane hit it at all. You can't wire a building in 6 hours. So it was wired days in advance. Which leads me to conclude Al-Qaeda didn't do this. It was an inside job. And if you haven't got over that and realized the truth, go Google General Stubblebine. He's the Intel General for the United States, a major general who said no plane hit the Pentagon and no planes that hit the Twin Towers brought them down.
We pride ourselves with the free press. I do not believe the free press is free anymore. It's very expensive. It's very expensive. And the press is saying what they have been told to say about this. Now, do I have proof of that? No. But I believe that certainly the stories that were told all about 9/11 were false. I mean, you take a look at the buildings falling down. They didn't fall down because airplanes hit them. They fell down because of explosives went off into the demolition. Look at Building 7, for God's sakes. It didn't fall down to its side. It didn't fall this direction or that direction. Just like the 2 towers. When you look at the temperatures that you can create with fuel in a gas tank or a fuel tank of an airplane, and then you investigate the amount of heat that it would be required to melt the superstructure of the buildings, that came tumbling down. When you put all of that together, the one thing that shows it does not match the facts. What is it they do not want the public to know?
Now, this is the guy who's in charge of American security at his last active duty post. And he's going all over Europe saying this. But you'll never hear it on the 5 major networks, what I call the 3 blind mice, ABC, CBS, NBC, and the official government propaganda channels, CNN and Fox. You'll never hear that. You won't hear Stubblebine on their channel. They're part of the matrix mind to destroy America, to reduce America to an absolute 5th-rate nation. And Obama death care is a big part of that. Thank you, Gwen. I appreciate it. What's the first section that we got here from Gwen, from the Liberty Counsel?
Okay, the first section is from Section 113, page 21 to 22 of the Health Care Bill mandates a government audit of books of all employers that self-insure in order to ensure that the law does not provide incentives for small and mid-sized employers to self-insure.
Wow. Hello, people. This is going to destroy small businesses. They're saying they're not going to let them self-insure. And a government audit means government employees going to be poking through everybody's books. It'll be difficult for anybody to employ anybody. Section 122, page 29, lines 4 to 16. Your health care will be rationed. Now, if any of you don't know what rationing is, go look it up. Or go look at the 1930s Depression era, where people were rationed on how much soup they could get at the soup kitchen.
123, page 30 states, there will be a government committee deciding what treatments and benefits you will get.
You like that idea?
No, but I'm sure you want me to smile now, don't you?
Well, I mean, it's laughable, Joyce. They're going to, some bureaucrat who's not even a medical person is going to decide what kind and what quality of benefits you get. That's insane. Section 142, page 42, the Health Choices Commissioners will choose your benefits for you. They're going to choose for you. Maybe you need a root canal this week really bad, but they decide to give you caps on your front teeth because the dentist that does caps is more available. So you suffer with a root canal, that's infected, not getting done, and you got an infected nerve in your root, and you just suffer. I don't like this. What do you got next, George?
Section 152, page 50 to 51. Health care will be provided to all non-U.S. citizens.
Wow. Don't you citizens, hard-working taxpayers, and you unemployed, formerly employed taxpayers love that? You're going to have all the non-U.S. citizens flooding into U.S. to get health benefits while you and your children suffer waiting. Don't matter that you may have worked for 20 years and then got laid off because your employer couldn't provide you with health insurance. You're going to now be forced on the government's Obama death care plan while foreigners get health care. And you wait, and your children suffer.
I suppose only Americans will now have to buy a traveler's insurance.
Good point. What else you got there, Joyce?
Let's see. I have section 163, page 58 to 59. Beginning at line 5, government will have real time to access individuals' finances and a national ID health care card will be issued. So, according to what you can afford, is the care you'll get.
Individuals' finances.
Yes.
Do you really want the government looking into your individual finances, Joyce?
Not particularly.
And I'll bet you most Americans don't want the government looking into your financial status to determine the quality and amount of health you get or what you've got to pay for it. This is communism, people. This is the bridge to total fascist Nazi style, worse than Nazi style. Even the Nazis didn't ration health care. People still had private doctors in Nazi Germany. They didn't. This is insanity. This is just, and then a national ID card. This is how they sneak in the national ID card that caused a dozen states of the 50 to threaten to secede from the Union.